Welcome to the Marketing Meeting podcast. Today, a part of the discussion is directly linked to marketing because we're going to talk about human brain psychology, but some of the parts will not be linked to marketing at all. So I convinced the best psychiatrist in the world to join me on the show today. She's not only the best psychiatrist, but she's the best sister in the world as well.
Thank you.
Welcome. My sister Defne Eraslan is on the show today.
Yay.
So can you tell people what you do? Well, they know that you're a psychiatrist, but where you work and the areas that you focus on a lot.
Yes, I'm at the moment in Germany at a hospital. I'm originally from Turkey, like you. I have done my associate professorship and my cognitive behavioral therapist education in Turkey. I'm a psychiatrist, cognitive behavioral therapist. I have worked in the pharma industry shortly, and I am especially interested in mood disorders, ADHD, and women's mental health.
So we are entering the last month of 2024. So we are recording towards the end of November, almost December. People usually start putting goals, resolutions around this time. However, I'm putting goals to myself till the end of the year, meaning that, okay, the things that I need to accomplish till the new year comes. And one of that goal is also to put the goals for 2025. Could you please advise if this is healthy?
Well, I think it makes sense to plan, and we know that New Year is an arbitrary time point in the in our lives, and for other people there are other New Years. But I think reflecting on the time before and thinking of the time ahead is a good idea. If you don't set your goals too high, if you're not stressed with the things that you didn't accomplish, if you are doing that with a positive perspective, what did I manage to do instead of what did I not manage to do? I think it's a good thing to reflect and plan. And New Year's are usually the best time to do that.
Mm-hmm. But I mean, like, for example, for myself, whenever I put goals, it's almost like, although I learned that I should be putting realistic goals, but it's almost like it can never be achievable around that period of time. For me, it's like putting unrealistic goals is what I do. Are there some common
family illness?
You are like that too?
Yes, of course.
Okay. What are some mistakes that people do, or your patients do when they are putting goals for themselves?
Yes, the most important one is not having realistic goals or planning too much. Just the other day, one of my friends said, I did a lot this week and I am at least not behind my schedule. And I said to him, I'm always behind my schedule, because if I'm able to do things faster than I can, then I plan too much. So I'm always falling behind, which causes stress. So actually planning too much and being too optimistic about the things we could do and how we could use the time before us is one of the one of the mistakes that is done quite often. And of course, we all have our own problems, things that make life difficult for us. Sometimes we are doing it in an optimistic way and we don't change our expectations according to what we are going through. Sometimes we plan something, but something else comes along, which is quite important, or maybe not important, but inescapable. But we still think that we have to reach the goals that we set before this disaster happened or the stressful thing happened. I think that's one of the things, not setting realistic goals, thinking that the time we have before us is quite long, and not being able to be flexible when we have other problems is one of the reasons that goals are stressful for most of the people.
But do you have some techniques or some recommendations for people that are constantly putting unrealistic goals? Because for me, I know that it's just like, of course, I'm taking lights on me always in a sister and relationship, but we'll cut this part because I kind of lost what I was going to ask. Okay, so
İnsanlara önerebileceğin şeyler var mı diye sor.
Tamam. Let's start from here. What are some common things that you offer as a technique? Is there any technique to put realistic goals? Because for me, I know that I always set unrealistic goals that I will never be able to achieve 100% of that. What's the solution to that?
First of all, you have to ask yourself why you do that. What is the reason? Are you not realistic, or do you need too big goals to motivate yourself? So try to understand the reasons to that, and of course it makes sense to plan things as steps. I want to at least do this, and this is the first step to do that, and then if I'm able to do that, this is the next step, and then I will change my plan in the future, in the coming days, if I am not going the right way. So it makes sense to plan it like small steps that are following each other. I think that's the best way to set up realistic goals, apart from understanding and challenging why you are not setting up realistic goals in the first place.
I think social media is not supporting but amplifying this a lot, because I'm going to move on to the multitasking and efficiency topic, because I think everyone in the world is talking about efficiency, and there are like hundreds of efficiency apps, which I tried to use in the past, and I was not able to do that anyway. What's this thing about being so efficient? And then everybody is talking about efficiency, and it feels to me that everyone only except me is efficient and I'm not. What is this thing?
Yes, I think not that I think that it's a reality that we only see the shiny parts of people's lives in social media, and this results in it is proven that social media results in consuming too much social media results in low self-esteem, depressive mood, more anxiety. This is more clear. This is clearer in young people, but actually, overall, it's the reality. Although we all know that the life in the social media is not the real life that people are living. We see the best parts of people's lives, and then we compare it with something that we see only that we ourselves only see. So we know how difficult our life is. Sometimes we are lazy, sometimes we don't have the energy, sometimes we have lots of small things in life that we have to do. We know all that, but we see only the productive part of people's lives. And sometimes they are really lying or exaggerating, and sometimes they are just telling part of the truth. And of course, although it is known to us, we know that what we are posting is bright side of our lives, but still we compare the worst of us with the best of other people, which makes us, of course, jealous, and which reduces our self-esteem. It seems, this fear of missing out, it seems everyone else is able to do lots of good things and we are not. I, as a psychiatrist, of course, have been able to see the other side of that equation. I have seen, famous people, rich people, successful people, having problems in their lives. But still, as somebody who knows the difficulties in everybody's life, it is not easy for me to believe that, these people are, they are producing great stuff. I'm not saying that people should stop producing great stuff in the social media, but there's a cost to it, and there's some work behind it, and everybody has their own difficulties apart from the life that they are showing us. Even if I personally know how it is, because I'm, getting close to people in another level, I still cannot help thinking that I am not as good, and I'm just lazy, and I'm a failure, and other people are all making it great. So that's the difficulty with social media, and to change it, because of this feeling, we want to be effective. We want to use our 24 hours in the most efficient way, but this causes lots of problems. This causes multitasking, and this causes the opposite of mindfulness. But I think we will get to that on our way.
The thing is, what you say is that as a psychiatrist, you know the other side of the medal, and you know that these people, that these shiny lives that we've seen, actually also had non-shiny parts to it as well. And then, but still, you also get sometimes jealous, sometimes stressed that you are not doing too much. So what is the solution to that? I mean, like, is it that we just close social media, or moderate it, or what's the solution that you suggest to your patients? Or is there a solution?
Yes, of course, limiting social media is one of the solutions. And constantly reminding ourselves that people all have their own difficulties is one of the solutions. And I think one of the biggest things is, okay, these people are doing that, but is this important for me? Is this what I want to do? So constantly trying to remind ourselves that we decide what we want to do on our way. So we should be clearer about the things we personally want to do, not the things that we want to show other people, or not the things that the other people have done that actually don't fit us. So I think we really, and we started with the New Year's resolutions. I think the best New Year's or new quarter resolutions, they are the ones about thinking what we would like to do, what is missing in our lives, and not comparing ourselves to other people, but doing the things that we want more in our lives.
It's kind of this funny emoji that turned out. Anyway, I would like to move to mental disorder, because we know that it's important to find the signs for ourselves, that if we have a mental disorder or not, also, or for the people that we love. Or around us. What are some of the warning signs of a mental health disorder? Of course, there are so many of them out there, but some specific ones that we need to pay attention to.
Actually, I think it makes sense to think of the classical definition of disorder. Psychiatry is a very specific area. For example, if somebody has got cancer, if they either have it or not, or we have cutoff points, for example, for diabetes, for anemia. We know how it works there. In other bodily disorders, of course, psychiatry is a disorder of the body because brain is part of our body. But in psychiatry, it is not easy to decide if something is a disorder or it is just a difficulty that somebody is having, or as a personality trait. For example, things like anxiety, sadness, happiness, these are, or attention deficit, these are all things that make us human. These are all parts of our lives, and these are normal to some degree. Somebody can be sad after an event in their lives, and this might make the life difficult. So the difference between a disorder and a symptom in psychiatry is defined by how much difficulty it is causing in somebody's life, how much it is putting their functionality at risk. So, of course, this is something difficult, and it is not just not what the person sees. Sometimes the person thinks it's he or she is perfect, but it might cause a difficulty in their lives, for example. So, so the difference between some symptoms that we all have and a disorder is that needs treatment, therapy, pharmacological therapy, psychotherapy, is the amount of distress it causes and the amount of problems it causes in the functionality.
So you mean that the portion that it affects the life negatively is a sign already?
Of course.
But for example, some of the times, like just like everyone else, we get sad. And how can I understand that it's a depression rather than just feeling down?
So the classical definition for depression is, for example, I think that's a good example because we all feel sad. But in order to diagnose a depression, we have to have there are 9 signs of depression in DSM, the American manual for psychiatric disorders, and you have to have 5 of them. One of them has to be a depressive mood and not enjoying the things that you had to enjoy. You have to have them at least 2 weeks, most of the day. So, and it shouldn't be related to a very sad event like a loss. It shouldn't be related to, illness, like, a thyroid illness or another illness that in the body. So that's the definition of depression. So we have some time limitations, how many symptoms that somebody has, and how much of the day these symptoms take. That is one of the clearest definitions, actually.
For example, a friend of mine had a rash. She has been scratching herself for like almost 2 weeks. She went to all the doctors to check everything, if she has like a parasites or whatever, and there was nothing at all. And then she was like saying, I think this is completely mental. I should see your sister. Is there like things like that, that we don't know? Like, of course, sleep disorders probably another sign of a depression, but is there like those type of things, like you have a rash and you scratch yourself a lot and so on?
Yes, they are. It doesn't have to be related to a depression, but we know that lots of bodily disorders have got something to do with psychological conditions. it just doesn't need to be depression. But of course, dermatological disorders, gastroenterological disorders, these are the ones that, pain disorders, they are the disorders that are mostly related with psychological things. That's why I always have a good relationship with dermatologists and gastroenterologists, because we really have things in common. It's not just, of course, there's something, there's something in the body that makes it possible to have a dermatological condition, but stress just makes it more possible. This doesn't mean that she has a psychological diagnosis, but maybe if she has stress, this might make her dermatological condition more possible.
When do we need the medication for psychiatry? And because there's a tendency between people is that, okay, for example, someone gets cancer and they say, okay, it's because that you just made things worse in your life and your mind is causing you this cancer type of thing.
Yes, I'm very angry with that. Okay.
Because I mean, like a lot of things they say, I mean, also even with my friend who has a rash, I'm telling to her, I mean, maybe you should see a psychiatrist now because it's your mind that is causing this problem. There's like this tendency to tell to people that we are causing the problem that we are facing. Either it's going to be like a stomach problem or a stress disorder or whatever. What's your take on this?
Yes, that's really interesting, because on one hand, this thing about sending these messages to the universe, and you are calling your own illness. So there's this psychology. How do you say it? There's a psychological approach that we are causing our bodily problems, which are really clear, like cancer. So we are responsible because of them. And on the other hand, there's a tendency of not treating psychiatric disorders or not believing in psychiatric disorders. So this is really a dilemma. So nobody can just cause cancer because they are stressed about things. They are feeling guilty about things, and they want to do. People have told me, for example, breast cancer is actually you being in conflict with your womanhood, things like that. So I am really angry about that. I am really angry that people with cancer, with diabetes, with all of the bodily problems are apart from the stress that they are living in their lives, they are also being they feel they are being to feel, they are pushed to feel guilty about these illnesses that they didn't have. Of course, we have a responsibility. We shouldn't push ourselves too much. It would be great if we just saw our stress and then try to do something about it. But I think this is cruel that we think that we are able to cause everything with our minds. No, we are not. No, we are not. There are illnesses. Of course, they are made, they are more available and we are under more risk if we have stress. But even if we are the most, common person, we could have cancer and gastroenterologic problems and dermatologic problems, although they are also, they have psychiatric components as well. And as I've said, on the other hand, that's the same thing. People think that when you have an obsessive compulsive disorder, when you have an ADHD, even worse, if you have schizophrenia, people think that you could just, beat these problems with your own willpower, which although, in depression, willpower is destroyed because the parts of the body that are able to create willpower are not working. So, and when you just say, okay, get over with it, and then pull yourself together, and they are not able to do that. They are not able to wash the comb their
hairs.
So I am really thinking that this approach to psychiatric disorders is really cruel, and then this psychiatric approach to other bodily illnesses is also very cruel. I'm really angry with that. I can talk about it over and over.
I mean, the thing is, so you mentioned that there's like a chemical thing. That is it a chemical thing that's happening in our brains that is not letting us even comb our hair? Or
Yes.
is it usually there's like a mechanical, like chemical problem happening, or sometimes it's not the chemical problem at all?
Yes, it's a chemical problem because our nerve cells they interact with chemical and electrical impulses, and it's not just our brain. So think of it as our brain, our whole stress system, and now there are also very interesting things about our gastrointestinal system that is causing some of our or helping with some of our psychiatric problems. So it's a problem, but it's not clear as other medical problems because brain is a very complicated organ, and the hormonal system is very complicated. They are functional problems, so you cannot, sometimes you can see them. We know that in end stage schizophrenia there are changes in the brain that we really can see in the MRI, or in chronic depression there are parts of the brain that are shrinking, but usually it is more functional. So it's about the chemistry and electricity, and we didn't have the real means to see that until the last couple of decades. So because we cannot see it, we think that this has got to be to do with willpower. There are all kinds of cults like Scientology and all the stuff that say that psychiatry just doesn't exist and psychiatric illnesses just don't exist. There's the other part of the equation. Of course, there are people who medicalize everything and put a diagnosis on everything. That's the other part of it. But psychiatric disorders are bodily disorders. Of course, you can do things about psychiatric disorders with your willpower if you have that willpower. Think of it like diabetes, actually. So when you have diabetes, there are things that you can change, like your lifestyle, how much sugar you eat, how much exercise you do. But there are things, even if you do all of the things, at some point you might need medication or insulin. That's the same thing about psychiatry. I think diabetes is quite equal to psychiatric problems. Of course, there are things that you can do, but sometimes you just have to take the medication. And it hurts me because I know that there are people. Sometimes I'm a therapist as well. And to be clear, if somebody doesn't make any medication, I earn more money through therapies because it goes away in a longer time sometimes.
Yeah.
So I'm somebody who gives medications and who does psychotherapy, and I think that's the best approach. But sometimes I see people that are struggling over the years, and then they don't want to take medications, but I see how much they could benefit from them. There are people who just need psychotherapy, that's clear. And of course it hurts me, although I'm doing the therapy and we are doing baby steps, but I sometimes think, okay, it could have been better if I just was able to prescribe. And then I have all of my patients. I've been in psychiatry since 25 years now. So I have always had these patients or clients that come and say, the life is completely different. Why did I wait for years to take this medication? So because of that, I'm really angry about this, power game and about this prejudice about psychiatric disorders. But it's the case, unfortunately.
I think there's a people confuse. I mean, we confuse things about like brain and mind. As if they're like mind
Different
is like
things.
a different thing.
Like,
but it's
is
it different?
Of course. Of course not. So there's a great book I would recommend. It's Descartes' Failure. So actually, in the old age, people thought that there's a spirit and there's the body. So there's this dualism. In which the body and the mind were different things. Now we know that, all of the things about our mind are just functions of our body. Mainly our brain, of course, but not just our brain, that we are learning as well. So everything that we feel just happens here and a little bit down under. So, this dualist approach is, of course, what makes everything difficult about psychiatry. But the more we have, techniques to see these changes in the brain function, and the more we are able to make diseases better through therapy and psychopharmacology, I think it will change. We shouldn't forget that, 50, 60 years ago, people just couldn't treat schizophrenia, and people had to be living in hospitals for all of their lives. The very old film Awakenings from Robin Williams is about that thing. So when you compare it to now, people with schizophrenia just going on with their lives with some difficulties, I think we have gone quite a long way. And as we move along and then help people, I think it will be better with this prejudice.
A friend of mine from LinkedIn, because I posted about that I'm going to interview a psychiatrist today, and I asked if you have any questions. And he said that will there ever be a time that humans will again become less dependent on professional psychological aid and support? And to what extent does she believe people around us can successfully fulfill that role? And he also said that he also believe that the need for psychological aid should never be normalized, considered something natural or normal.
There's something that I agree with them, which is I always hear from people, you're a psychiatrist. When they learn that I'm a psychiatrist, they say, oh, okay, we all need psychiatrists. Of course, this is not the case, psychiatrists or psychologists. Normally, people, when they are going through difficulties, they don't necessarily need psychiatrists or psychologists. But of course, when you talk about things with your friends, they are not neutral, and they don't know the techniques that could help you effectively. So, of course, in the best world in which we didn't have to be so productive, and we had all the time to spend with our social relationships, and in the best world in which all of the people around us are very rational and giving us good advice, maybe no one would need that's not true. People with psychiatric disorders would go on needing psychologists. But maybe other people with difficulties in their lives just could go on with that. I agree with them. I don't think that everybody needs a psychiatrist or psychologist. But I think that, discussing things with a psychologist at some point in your life, just helps you decide or go on with your decisions easier. So I don't think it's a big deal. I don't think that we should make it seem so high or so low. I think that if somebody thinks they need it, they could just try it, and then when they try it and then they have solved their problems, they don't need to go on with that.
Yeah. I'll move on to ADHD and focus because that's it seems that everybody around us has ADHD. How can I know if I have ADHD or am I just distracted? How can you diagnose ADHD?
Yes, so it's the same thing actually. So if it causes a significant problem, and if you have it more than other people around you, then you should think of checking it. There's a great book about its name is it's called The Stolen Focus, and we know that the new world with social media and all of the distractions from electronic devices and all of the algorithms that are really competing for our attention is making us inattentive. That's clear. Everybody has got an attention problem at this point because we have so much input, and we have so much input from the outside. And there's also, as you said in the beginning of this talk, there's too much that we want to achieve. So there's also too much input from the inside as aims. So it's not easy to be attentive at this time. This is something that we all live. This doesn't have to be have a diagnosis, or this doesn't have to be treated with medication. But on the other hand, there are people that have just not been diagnosed for all of their lives, and that have really suffered because of their ADHD since their childhood. And I am working in a clinic in Germany who is specialized in ADHD and autism. And you cannot believe how much good treatment changes in people's lives. So, these are people that come to us with a depression, for example, or a social phobia, and their life is, a story of failures and broken relationships, problems in their lives because of their impulsivity. And the depression is actually the result of all of these frustrations they have. And then when you diagnose it, people are actually, they feel a relief. Okay, there's a reason for all of the things that I lived. So it wasn't me. I wasn't lazy. I wasn't unmotivated. I just had ADHD. So so it's a point where they stop, feeling guilty about what they achieved or they didn't achieve. So there's one group of people who just, self-diagnose with ADHD because it's the cool thing to do, to be neurodivergent, to have autism, to have ADHD. But there, on the other hand, there are all of these suffering people, and most of them are women, by the way. who have been feeling not very clever, not hardworking, because they had a problem with their attention. So we really have to make a balance with these two tendencies. This tendency to overdiagnose, but this risk of underdiagnosis actually in the last couple of decades. So when it's really a disorder, you cannot miss it, and then you really get good results. It's life-changing when somebody...
Do you do tests on that?
Of
Like
course.
there are like ADHD tests?
Of course. There are clinical tests. You just ask some clinical questions. So in order to diagnose ADHD, by the way, you have to prove that these problems about hyperactivity or attention deficit, they were already there as they were kids, and it was more in comparison to other kids. For example, there are things like not liking to do homework or forgetting your things at school. That's something that all kids do. But the problem is, the question is, did you have that more than other kids? So there are clinical interviews and tests. And usually you can diagnose it with these clinical interviews and tests with the symptoms. We sometimes ask for, actually the notes from the teachers from primary school. Sometimes, for example, in Germany, teachers write about the child in a paragraph. It's not just the notes, but the things that the teacher said about this kid. We talk with the parents if they are available, and then there are also tests, neurocognitive tests that are made in the computer that support that. But you don't have those. You don't need those tests to diagnose ADHD. But they are also supportive. Sometimes you see that that person has ADHD or ADD, similar problems with attention, impulsivity and things like that.
What's the solution? Are there like medical treatments and also combined with like some other techniques that you can apply to your life? Physical things that you can apply.
Yes, the practical things are very important. Even if you decide to have treatments, there are treatments, and
you mean medical treatments, right?
Medical treatments, and that are usually abused actually from college students at the moment because they are stimulants. They work in a different way in people with ADHD. So there's a huge group of college students or intellectuals that are just abusing these ADHD treatments, like drugs actually. But of course, even if you have treatments, it's very important to arrange your life. And I think with the amount of attention problems that we all have, even if we don't have the diagnosis, I think it's necessary and it's useful actually to think of these practical things that we have to arrange in our lives.
What type of practical things usually work?
Of course, the problem with ADHD, people with ADHD, ADD, and the modern person is that they want to multitask.
Oh,
so
I like it.
So multitasking is considered to be a strength, but it is actually something that is a big problem for our attention. So they say, for example, they say it as a strength for women, but we know that multitasking makes your attention worse. That's very clear. Everybody has got problems with multitasking. So what is multitasking? Doing more than one thing at the same time.
At the same time, yeah.
So women have got less problems, but they still have big problems as they are multitasking. So actually, multitasking is one of the problems. So we ask them to, focus on things, reduce distractions, and try to do one thing at a time, to prioritize, and to have realistic expectations. That's the thing that we talked about. So, ADHD people are very curious. People that have ADD, they are very curious. They are really open to new ideas, their mind. And when they have something new, they go all in.
Very so focused, right?
That's the so-called hyper focus, actually. When something is interesting, they are really focused, and they can do lots of work in a very short time when they are interested. That's the thing, and that's the reason why ADHD or ADD has survived in human society, because if you choose the right work, if you choose the right tasks, as an ADD person, you are really able to succeed, actually, as long as you are interested and motivated. But the thing is, when something is getting, when something is not that new, they just lose that attention, and then the person who just did lots of unexpected things like this very easily, just isn't able to do the last thing that is needed because it's boring. So, but before this diagnosis and this medications, actually people with ADD have managed to survive, and actually also even thrive in work. Finding some network, some supporters, and techniques to control their motivation. But the thing is, life is not just interesting things. Work life is not just interesting things. So if you just do lots of things because they are interesting for you, at some point you are exhausted. That's something that causes burnout. That causes the burnout that we see in people with ADHD. So it really is important to know what is too much, and to put borders, and to manage your expectations. That's one of the things that we suggest to people with ADHD.
So, I mean, let's say the things that they really like and they can really focus, they just do that. But for example, for the things that are boring or that are hard to do, that they don't have too much of patience, should they take help on that, or what's the solution to that? Or they just do the things that they like to do? I don't know. Because that's also the thing.
Yeah, if their life could just be like that.
Yeah.
So of course, the thing is, there are very lucky people who just do interesting things. But it's this doesn't count for all of us. So because of that, there are techniques like that. Trying to limit your day, trying to program your day, doing the easy but boring tasks at a time, that at a limited time, trying to solve them just like that. And then of course outsourcing is very important. Collaborating with other people is very important, or feeling responsible for other people is very important. But the thing is, people with attention deficit, whether it's an illness or not, they don't know. They cannot know. They don't know where to stop. So the thing is, doing one thing at a time, if possible, and then finishing it, and then going on to the other thing, if possible. So limiting yourself, knowing your where to stop, it's very important. But that's the thing that we all have to do. What is important for me? If this is important for me, then even if it's boring, I go on doing that. But of course, I need to eliminate things that are boring and not useful. Then I should if I can, I should then outsource them, or try to finish them very practically so that they don't block my way.
If a friend of mine asks, it's just, he's like, I have a focus problem, and if she has a hack that she can suggest.
So the hack is putting off your phone and doing one thing at a time. That's very important.
Just like, so we're not going to listen to a podcast when we are trying to do sports or trying to cook.
I mean, if you're just walking, for example, you can just listen to a podcast. That's great. For example, that I used to do that as well. Because I'm a mother who is trying to survive in a new country, and to do psychiatry in a new language, and even especially when that language is German, it's not easy. But you also you have expectations from yourself. You don't want your life to be just cooking and washing and then going to work. So I used to do that. After a day of making psychotherapy in German, I would come home and then put on my headphones and then at the same time cook, for example, or go walking. But then I realized that of course that satisfied something in me, because I was feeling more effective and I was feeling like me. That I understand. For example, yesterday I went for a walk in the forest, and I did it but I was relaxed and it was fun to do. But for example, if I want to do it on a day that I'm exhausted, the thing that I'm trying to cook, the kids are asking something, and then I have to stop the podcast over and over again because it's a challenging subject, then it makes me more tired.
Yeah. And then you just want to...
And then, I just slap somebody when somebody says something to me. So the thing is, there are times that we can multitask. For example, listening to a podcast that we find interesting as we are walking, that's great. But if I am doing it at a time when I just need relaxation and I need to calm down, I'm just overstimulating myself. That's counteractive. So we have to find a balance between that.
One last thing that I want to ask, because that's always a discussion between me and friends, monitoring stress and reducing stress. So some people use weed and CBD. Like a lot of my friends, they are using it because they say that, okay, it's the natural thing. Instead of using a psychiatric pill, I'm using this weed or CBD every night so that I'm relaxed. I don't have any anxiety. It's a natural thing. I'm going to do that. What's your perspective on this?
You are really hitting points that could trigger me to talk for hours and hours.
I mean, yeah, maybe we can take like 5 minutes on this topic, and then maybe do another episode on that.
Of course, coming down and being less stressed is something good. And we think that weed is something natural, and because of that, it doesn't hurt us. But there are lots of there are many toxins that could make us drop dead in seconds, that are natural or botanical. So that something is made from a natural source doesn't mean that it is not risky, and it doesn't hurt your health. So there's this CBD part. If we want to make it very simple, in cannabis, this weed, there's this CBD part which really helps with coming down, and it's available actually just as the CBD. And there are some studies that are going on to show that it might really help with anxiety and sleep. Yes. But there's this THC part, which is in the same last years becoming more and more and more, which makes you addictive, which might cause anxiety, which might cause psychosis. So, so there's the useful part, and there's the activating and problematic part.
Because it's both CBD, right? You are talking about, like, no, inside the CBD
is inside cannabis, this weed. So the problem is, in the last 10-15 years, the amount of the comparison, the ratio of THC to CBD has risen. So the weed that people are consuming at this time isn't the weed that people were consuming in the 1960s. That one was really more calming. And this one is more addictive. This might cause more stress, and might cause even psychosis, especially when you do it too much and in an early age. And the thing is, I have seen many people. Of course, I know that there are people who just consume weed regularly and nothing happens. They are the happy group. But apart from this risk of panic attacks and psychosis that really is dangerous, I also see an evolutional syndrome, which just reduces your motivation to succeed more in life. So you know the type of person who just doesn't care about things, who just finds everything unnecessary, and just goes on smoking weed and doing nothing else. That is a fact, and that is one of the biggest problems. So of course, as I've said, if you find CBD and it helps you, it could be, but thinking that something is not dangerous because it's natural is a big mistake, I think. There are lots of other ways to calm down. At least apart from the weed, one should think of the other ways to calm down, because of the risks of cognitive risks and this evolutional syndrome risk with CBD.
I used to have like a discussion with a young person who was saying that, I mean, it's better to smoke weed compared to taking an alcohol, because alcohol is something that is very bad for your body. It's bad for your liver and so on. It's better to take weed because it's completely natural. Whereas
alcohol is also completely natural. It's made of grapes or potatoes, that's right, or whatever. So when you think about it, it's also that natural. There's synthetic alcohol coming, but it hasn't come yet. All of the alcohol is natural. Why don't we drink alcohol? Because we know that is nicotine is also natural. It is the most important reason for death in our societies. So so that argument that is bullshit. That's very bad. That's very bad to finish with this thing, but anyway.
Do you ever diagnose your friends or family at the coffee table or dinner table?
I try not to.
Or your family members, do they do that to you?
Yeah, you cannot take any diagnosis from me. The best compliment that I get from my best friends. I have a good girls group from high school, and another person who is a friend but not a close one just told them, so you are very lucky, you have Daphne and she analyzes everything and she's your psychiatrist. And then my friend said, no, Daphne is just not a psychiatrist or a psychologist. She's just a normal person when we are talking to each other. That's really what I really want to do. All my life, I really tried not to be a psychiatrist in my personal life. Of course, it changes how you look at things. My husband is a psychiatrist as well. So we try not to analyze things. We try not to use our psychiatric skills or diagnosis in our discussions, arguments. So we really try to do that. But sometimes, of course, we feel things, but we try to keep them separate. This is not an easy task.
Yeah, I know. But I still sometimes get angry with you if you sometimes act like like asking open-ended, which why do you think like that? I'm just like, don't behave like a psychiatrist to me. You're my sister.
Yes.
But you do it only like just a couple of times. That's it.
Yes. And if people just DM me, I can tell them your diagnosis personally.
Okay, my diagnosis.
Yes, your diagnosis.
What's your diagnosis for me? Just tell me in a few words. What's my problem?
Well, I think that you are maybe sometimes too perfectionistic, which makes your what you produce great, of course, like your podcasts and the work you do in marketing. But sometimes it makes you tired. That's one of the diagnoses that makes your work wonderful, but your life difficult.
Okay, thank you so much. And you can also tell openly that I'm better than you, which is a fact.
Of course. Thank you so much. It's a fact.
Thank you so much for joining me, and we might do another episode about like some other topics, like about this weed. Or I was going to ask you if left and right brain things are working or so on.
But ask that. But anyway, I would be happy to do that.
Okay, what's your favorite coffee place in Germany, so that we can go there together when I come over?
Well, there are some in Berlin, but the one that I really go to is not that much of a cool place, but I like it very much. It's a flower shop and a cafe near my children's gymnasium school, high school. It's called Blumenbett. That I like very much.
Okay, and one final thing: what's your favorite? What's one book that you would suggest to people? Although you suggested one book, which is The Stolen Mind or Stolen Focus, is there any other book that you suggest to people for psychiatry?
I should have thought about that, actually.
You can cut this part.
At the moment, this is the one that's interesting. Okay, I can say something. Determined. From Sapolsky. It's actually talking about how our willpower is not just the thing that defines our lives, which I find very important. Determined from Sapolsky.
Oh, okay. I'm going to read that one.
Yes.
And I'm looking forward to having that coffee in Blumenbett soon, in 15 days.
Yes.
Thank you so much.
I'm looking forward to that. Bye.